Okay, so we're going to talk about the os coxa or hip bone. The os coxa is made up of three fused bones that come together here in the acetabulum or hip socket. The upper bone that comes up this way is the ilium. It comes down and fuses with two inferior bones. The anterior inferior bone is called the pubic bone, also known as the pubis. Then the posterior inferior bone, which is right here, is called the ischium. We're going to talk about three landmarks to get our orientation down of this hip bone or os coxa. We'll go ahead and start with the first one being the acetabulum. That's where all three bones fuse, the ilium, pubic bone, and ischium. When they fuse, they make up this hip socket. There's three structures. The first is this upper surface called the labral surface of the acetabulum. Then deep in here where the black marking is at, that is called the acetabular fossa. And at the inferior end of the labral surface and the acetabular fossa is the acetabular notch. So the acetabulum is the socket for the hip joint. It's always going to be on the external side of the os coxa or hip bone, whereas on the internal side we don't see the acetabulum. So then if we flip back over to the external side, the second landmark we're going to look at is this big notch right here called the greater sciatic notch. It comes down, it's part of the ilium, comes down and ends where the ischium begins right back here. So the greater sciatic notch is always on the posterior side of the os coxa or hip bone. So we can see this is the external side, this is the posterior, so therefore this is the anterior side of the os coxa. And the last landmark that we're going to use for our orientation is this big opening here called the obturator foramen. It always goes down. So this is the inferior, and this is the superior end up here where the ilium is at. So if we flip it this way, now we know that this is the inferior, this is posterior, and this is internal versus external because we don't have the acetabulum. So when we look at this, it's good to have our orientation down because now we know that this greater sciatic notch goes to the posterior, the acetabulum goes on the external side, and then the obturator foramen goes down. So this os coxa would sit like this, so this would be a right-sided os coxal bone. We'll go ahead and talk about structures of the ilium independently from the pubic and ischium. So up here on the ilium, we have this upper portion here, which is called the iliac crest that runs all the way from the front to the back. Along the iliac crest, we have this iliac tubercle right here. On the big outside wing surface of the ilium, we have what's called the gluteal surface. Then if we follow the iliac crest from front to back, we have these bumps or spines that are present. On the posterior side, just above the greater sciatic notch, marked in blue, we have the posterior superior iliac spine, also called the PSIS. And then there's a little notch, and below it, marked in red, we have what's called the posterior inferior iliac spine, or PIIS. Then if we come back up to the iliac crest to the anterior side, we find we have this bump right here. This is going to be the anterior superior iliac spine, or ASIS. Then we have another little notch, and then we have another spine, which is the anterior inferior iliac spine, or AIIS. Then we can flip the ilium to the internal side. On the internal side, we have this internal surface that's concaved on the wing of the ilium, and this is called the iliac fossa. On the posterior side, just above the greater sciatic notch on the internal surface, we have two surfaces that help articulate the ilium with the sacrum to help form the pelvis. This comprises what's called the sacroiliac joint. And so on the ilium, we have this auricular surface, which is right here, which has this ear-shaped, and that's why we call it auricular. And then posterior superior to that, we have this rough surface here called the articular surface. And these are going to articulate with the sacrum when we go to make up the pelvis like this. Here we can see this right side, and it'll articulate in this area right in through here. Okay. Then we'll move on from the ilium that covers all of our ilium structures. We can come down here and go to the anterior inferior bone, which is the pubic bone. On the pubic bone, we have the body of the pubis, which is right here. sitting on top of the body of the pubic bone, we have this orange marking called the pubic tubercle. Then off of the body of the pubic bone, or body of the pubis, we have an inferior ramus or arm, and we have a superior ramus or arm. On the superior ramus, we have what's called the pubic crest, which is this area right up here. That's that bony ridge that just sits right there, would be the pubic crest. The green marking is actually on the superior pubic ramus, which is right here. Now, on the pubic bone coming up to the ilium, we have this arcuate line, which runs right here, which helps make up part of our pelvic brim, which we'll talk about. And then this portion right here on the kind of the anterior side of the body of the pubic bone, we have this surface right here, and this will articulate with the left pubic bone to make up the symphysis pubis, or pubic symphysis joint. And then lastly, we'll finish up with the posterior inferior oscoxal bone. This is the ischium, which is right here. The main structures we have at the base of the greater sciatic notch of the ilium, we find that below that we have the ischial spine. Then we have another notch, which is called the lesser sciatic notch, that's found on the ischium. This big knob of bone right here is called the ischial tuberosity. When we're in a seated position, we actually set on these ischial tuberosities right back here, and it sets just like that. Then if we go just a little bit beyond the ischial tuberosity, we have the ischial ramus, which is right here, that connects and fuses with the inferior pubic ramus down below to create the obturator foramen. Okay, and that is our os coxal or hip bone.